Sure. Thank you very much, Lars. So it's a privilege to be moderating the session with Lars, and it's also a privilege to be among you all. Pfizer, as you may know, came into Harmony last year, and we are very excited to be taking part actively in Harmony and Harmony Plus. So if I'm not mistaken, it's not Professor Barbary who's presenting now, it's Professor Pagano, right? So yes. I will, okay, perfect. So just a brief introduction for Professor Pagano. Professor Pagano is currently the Associate Professor of Hematology at the Catholic University of Sacred Heart in Rome, and serves as an attending physician on the Division of Hematology Policlinico Gemelli, Roma, Italy. And he is the head of the unit for the treatment of hematologic malignancies in elderly patients. Professor Pagano is a member of numerous academic societies, and I believe most of you know him pretty well. And he has co-authored or authored over 300 original manuscripts. So it's with a lot of pleasure that we have Professor Pagano presenting to us the epidemiology of COVID-19 for patients with hematologic malignancies. So please, I will hand it over to you.
Thank you. Good evening, everybody. Thanks for the invitation and for the opportunity to introduce you our study. As already said previously by Guillermo, our survey is promoted by Infectious Disease Working Party of European Hematology Association. It is focused on the epidemiological analysis of COVID-19 in infection in hematologic malignancy patients. As for the background, all you know that COVID-19 infection is a clinical emergency that is affecting everyone in Europe and not European countries. Patients suffering from hematological malignancy are certainly those at highest risk of morbidity and mortality, both for the immune status linked to the underlying malignancy and for the treatment that they must receive. And in the last few months, various papers have been published. Apart the study by Passamonti and which involved all the Italian Society of Hematology and that collected more than 500 cases. All the others are on limited series and on specific pathologies, in example, acute myeloid leukemia, chronic lymphocytic leukemia. So we have no a correct idea of this infection in a large population. So the aims of our survey is to collect information on this infection in all the hematological malignancy patients on a large number, involving all the European centers of hematology, and in order to have a better and clear idea on the outcome of our patients. Regarding inclusion criteria and exclusion criteria, take note that this is a multicentric retrospective prospective study because we want to collect data from March 2020 until December 2020 for the moment, and is a not interventional study, but is only observational. As a inclusion criteria, we want to include only adult patients, patients aged 18 years old, and with an active hematological malignancy at any stage or status. And also all patients, in order to be included, must be positive to the SARS test. Patients with non-malignant hematological disease, not with a test negative, or patients off therapy from more than 5 years from the hematological malignancy are, of course, excluded from our survey. Our objective, the primitive objective, is to assess epidemiology outcome of patients with hematological malignancy infected by COVID-19 disease. Of course, from epidemiology, we means a registry of all cases. We cannot have the information regarding all the cases, because there is a problem to have all the data regarding all the patients with the entire hematological patients cohort or on the general population. So we cannot have the concrete incidence of these cases among all the other population. And as a secondary objective, we want to estimate the prevalence and the type of COVID-19 disease in our patients: symptomatic, asymptomatic, a severe disease, how many patients needs of the admission in intensive care units, how are the pre-existing comorbidities that they presented. We want to evaluate, above all, the mortality within the 30 days from diagnosis, and to estimate the rate of overall case fatality. And we want to know also the distribution in Europe of the disease, and stratify the patients for on-off therapy, for kind of therapy, chemotherapy, immunotherapy, cell therapy, stem cell transplant. Of course, we are hematologists, not intensivists or ID specialists. So we not want to know how is the kind of a treatment for these patients, because usually in my experience, these patients are not treated from hematologists, but when they present COVID-19 infection, they were followed in another units. Until now, we have the partnership and the endorsement of a lot of scientific group, apart the infectious disease group of HA, also of the group of aging and hematology. We have the support of a supportive treatment group of a Croatian cooperative group for hematological disease, from the SAFEM, that is the Italian group of survey for infection in patients with hematological disease, from the Danish National Registry of COVID-19, and from Italian Society of Hematology. But all members of HAA will be invited to participate. I want to give you just a few data that we already have collected. Take note that this study started, the collection started at the end of August. So in 1 month and a half, we already collected 355 cases among 57 centers in all Europe, as you can see here. In the arrow for Croatia and France, is indicated that 1 center for 12 centers or for 6 centers. So there is a good representance for these two countries. And I want to also say to you that between 13 October, when I prepared this picture, and today, we had more 50 cases again. So we now have 400 cases already registered in our database. And when the ethical committee of the local ethical committee of the centers that participate give their approval, already 250 cases were obtained. So we will arrive at present to 600 already in our database. And in this slide, I show you how are the distribution of the cases among these 355 patients that now we have. As you can read, the majority of them are myeloma or non-Hodgkin lymphoma, as expected. And it's interesting to see on the last column the mortality rate. The mortality rate, unfortunately, is dramatically high. and among 35% in acute myeloid leukemia. You please see where there is a lot of patients. Chronic lymphocytic leukemia, acute myeloid leukemia, multiple myeloma. It is near 35% for all these patients. Of course, we need more data with more patients in order to have a correct idea of all the situation in all the patients. And the final. We give no limits to the case that we can be enrolled. We hope to arrive to 1,200 patients at least. And I think, considering that the situation of the problem of COVID-19 that is present and is very important, as at the beginning in March, we want to continue our survey until June 2021. So we will have data retrospective and prospective. At January, we did the first, we will perform the first stop, and a first report will be produced and submitted with the preliminary results on the data that we collected. And we are evaluating also the opportunity to a long-term study on this population, above all to analyze the compliance in patients who recovered from infection with the therapeutic program of hematological malignancy. How many of these patients that are scheduled to perform a transplant after can perform this one? I invite all to participate to our study, because I think that more data we have, more information will be for everybody for a better know of this one. Thank you.
Thank you very much, Professor Pagano, for what appears to be a very pertinent and relevant current research. I don't believe there were any questions. There was a general question around presentations, which Ellen kindly responded that they will be available end of day Monday. Are there any other questions for Professor Pagano? If not, we will move on to the next presentation.
Yeah, thank you very much also from my side for this excellent presentation, or excellent presentation and proposal for a very important research project, I think, which also fits very well into harmony